Hi, my name is Jennifer Hawkins, and this is my community health project presentation to address hypertension that has been shown to be a problem for women inmates. In the United States, we incarcerate more women compared to the rest of the world, a 700% increase. African American rates are declining, but have the largest in-prison population and higher rates of hypertension. Women inmates have more chronic health problems, face family disruption as they leave their minor children, or may be pregnant when they enter the system. The United Nations Millennium Goals that were changed in 2015 to the Sustainable Development Goals include goals to ensure healthy lives and promote well-being for all, and eliminate gender disparities and empower women. Healthy People 2020 goals to decrease heart disease and stroke includes the modifiable risk factor of hypertension, which is a problem for 1 in 3 Americans and over 1 billion worldwide. Learning needs in this population will be assessed using a variety of methods as shown. As a community, each prison system is variable with different demographics, environments, and policies. Healthcare services will vary depending on resources. Even the ability to choose food options are limited. It will be important to find out what problems are important and health issues that are impacting hypertension rates in this particular prison. Often women in prison have low activity levels, poor nutrition, mental health issues, high levels of stress, and inadequate support systems. Cultural sensitivity is required for success in educating these women that considers assessed learning styles, literacy levels, and readiness to learn. Prioritization of learning needs takes into consideration that basic human needs must be met to allow the educator to foster maximum impact. With 1/3 of the population in the United States diagnosed with hypertension, and inmate populations having higher risks for hypertension and other chronic diseases, the need for implementation of a health promotion educational project is justified. The Precede-Proceed model is the health promotion model that will guide the development and planning of my teaching plan to be implemented for the women inmates. As health is a community issue, this model stresses promoting health by changing behaviors and attitudes. Individual participation in this health promotion educational intervention will be voluntary to make it meaningful, caring, and supportive for all participants. As involvement of stakeholders at the prison is critical, it cannot be overlooked. The precede phases will focus on the outcome to promote health of the prison women, to decrease the risk of developing hypertension, and the best intervention to bring about that result. The proceed phases focus on the actual implementation of the project. The goal will be to develop and implement a prison-based health promotion education plan that will empower women to engage in behaviors and screenings that will result in a decrease in risk factors associated with the development of hypertension. 3 objectives will be for the inmates to attend an educational class to increase knowledge and prevent hypertension by understanding risk factors and complications for uncontrolled hypertension. Second, commitment to make one behavior or lifestyle modification that can decrease risk for developing hypertension in the next month. And also commitment to periodic blood pressure and risk screenings to prevent complications that can result from uncontrolled hypertension. Information will be provided in the individual's primary language and health literacy level, using videos, handouts, discussion, and measurements of blood pressure and individual risks. The partnership between the patients and health professionals in the planning and execution of the educational plan will be important. Research gathered during the literature search included 3 articles that were used in gathering the evidence to support this plan. Health Promoting Prisons, Theory to Practice was a qualitative study that explored the opportunities and challenges that can arise when trying to promote health in prisons and the environmental influences for promoting health. Cardiovascular risk factors among prisoners is an integrated review of 12 studies that discuss the most common risk factors of prisoners and what prevention strategies could be directed to at-risk prisoners. Findings discuss the high levels of stress and increased cortisol levels that increase blood pressure. And the review found that by increasing self-efficacy through enhanced knowledge, it can change perceptions about personal risk, which has been shown to increase health-promoting behaviors while incarcerated. The Federal Bureau of Prisons has clinical practice guidelines which provide the evidence for recommended screening process for inmate populations and various prevention methods available for health professionals. Guidelines are based upon evidence-based research for managing and preventing hypertension. Outcomes will be evaluated using mixed methods, which will be designed in the initial stages that will be used during the evaluation phase of the model. Tools to measure success will include surveys, post-interviews, and periodic collection of data. Measurement of short-term effectiveness will be evaluated by the number of women who attend a pre-test and post-test of knowledge gained, and how behavioral attitudes that are integrated into the women's lives. Long-term will be measured in a maintenance of behaviors that were implemented in the short term and a decrease in risk factors associated with developing hypertension. With the rising costs, lack of consistent care across states and facilities, and the unique challenges facing women who are imprisoned, the traditional approach of education to change behavior that will then prevent illness and disease may not be sufficient. A whole systems approach that emphasizes improving psychological and mental well-being as a way to improve physical health should be considered. Another approach to health promotion that is being studied is to change the environment in prisons as a method to tackle health problems and promote health in these disadvantaged and vulnerable populations. These are the references I used for this presentation, and thank you for listening.